Hi, I'm Dr. Aletha Maybank, Assistant Commissioner, New York City Department of Health. I oversee what they call the Brooklyn District Public Health Office, and these are really the community arms of a large health department in New York City. And our focus and approach is really being there, kind of acting locally and thinking locally at the same time. And so core to what I do is really developing relationships. We all know that a lot of work that we do, it's really all about the relationships. And so I have relationships with community-based organizations, faith-based organizations, community boards, the NYPD, the DOT, schools, many different partners. And then what we try to do is really not only be a source of information, but also get information and feedback from the communities that we work with. So I grew up in Harrisburg, Pennsylvania, which is the capital of Pennsylvania. My family's actually though from Antigua, which is one of the islands in the Caribbean. My mom came here during the 60s, and she came here by herself, which I always think about, must have taken tremendous courage, because I think about going to another country on my own, and I don't really know how I would do that. But she came here, educated, put herself through school and through college, got married, and pregnant, moved from New York City, where she first came to, and went to Harrisburg, PA. And it's relevant because, one, my father didn't come with her, so she raised me as a single parent. Two, one of the reasons why she chose to leave New York City was so that she could provide more opportunities for me and raise a child how she felt a child should be raised, and she could do that better in Harrisburg, Pennsylvania, where the cost of living was cheaper. The consequence, there are many positives to that, but the consequence to it was that I grew up in a predominantly white suburban community, one of the only black children there, and as this is not a new story, many individuals who are different than the environments they have grown up have experienced it, and this is their story. But it definitely has impacted how I proceed through life, both for the positive and for the opportunities that I still need to work on for myself. And when I think about the work that I do in health equity, one of the big gaps that I see, or the situations, is that people many times don't believe or feel that they actually have the power to create change in their life. They feel their voice is not heard, which is true at times, and potentially that it's not even relevant. And I felt that many times growing up. And so part of my passion really rests from how do I help people find that voice for themselves so that they can advocate on their behalf. So in North and Central Brooklyn, where I work and where my office is located, it's a community that definitely doesn't have access to healthy fruits and vegetables the way that other communities across the city do. I know that stores in North and Central Brooklyn, almost 80% of them are bodegas, and bodegas, or convenience stores as other places call them across the country, are places that have a lot of just unhealthy junk food types of products all over the place when you walk inside of them. And then our supermarkets, we are getting more of them, but we have less supermarkets. The supermarkets are more likely to carry healthy foods. We do have farmers markets, which are great, and we have an increased use of them through some of our incentive programs to encourage people to use their spending and their dollars actually at the farmers markets by getting more dollars once they spend a few. But a lot of the work that I do, because I'm on the government side, goes beyond just the programmatic work of providing incentives, but it also goes around how do we change the environment. How do we change the systems of which people live when it comes to the conversation around food? Which has always been, when we talk about, again, the role of government, government has been responsible. When we think about infectious diseases and the creation of sanitation practices and sanitation workers and food inspections, all of those things geared more so to eliminating infectious diseases have always been, again, how do you change the system and the environment so that it's healthier? And so now we've shifted to the food conversation and chronic disease. And we have, our second most preventable cause of death is obesity and diseases related to obesity. And that's our shift in chronic. And I think it's been a challenge because once you start to talk about what people can and cannot eat, and outside of just saying you shouldn't eat that and this is what's good for you, and then you start to tell people through policies, well, you can't eat that or you can have access to that potentially, it doesn't feel good to people, especially when it's from the government perspective. And it becomes, a relationship that is based in power, or a conversation rather, that's based around power and people's perception of it, people's perception that it's being overused, and that people are taking liberties where they shouldn't have had liberties before, and taking away people's freedoms by saying that these things should happen. And I think, public health community is dealing with, especially on the government side, is now, how do we create messages that better align to where people are at in their understanding of the role of government potentially in this food conversation. How do we get to that understanding, and then how do we allow people the space to voice their concerns while still understanding that these policies and systems really have a population level effect and will really in the long run decrease some of these chronic diseases. But what I realize in my work is that it's not just this is how it should be one day, it's going to be one day and this is how it should be the next day. And again, it's a process, and it's a process in which we allow our community residents to sit at the table, to be a part of the conversation, and to be a part of that conversation not just because it's a nice thing to do. I think it's morally right to do, but also our communities know their communities better than we do. And if we want to create impact, have sustainability, I truly believe that any of us in any community that we are involved in need to be a part of that conversation to create solutions that are relevant for the people that we are putting them in place for. And so I feel the role of public health, especially on the government end, is kind of not only this policy piece and this overarching conversation and this overarching, we think this is what's best for our community, but also how do we engage our communities in this process? How do we mobilize, elevate the level of consciousness about a particular issue, and then mobilize our communities to act? I think that's the newer role of government. I think about food in the context of my family and how I grew up. My mom, in my direct family, my mom early on had high cholesterol and was diagnosed with it during a time when high cholesterol became this buzzword, and oat bran came out and egg beaters came out. So I was the only kid during like the 80s, 90s that was eating these products that really I feel like had no taste at that time. But I was a very healthy kid. Like I didn't eat a lot of cholesterol because of my mother's diet, and she incorporated very early on eating a lot of vegetables and a lot of fruits as compared to some of my other friends, her eating a lot of processed foods. We were eating steakums at one point in time, but then that evolved. But I had a different context within my individual household. And then when I think about, my family again is from Antigua and the islands, and I go about every 2 years, and every time I go home to Antigua, I come back feeling so different and so good, because not only is the food just natural and that I'm getting whole foods every single day, fruits and vegetables, you name it, like every single day. I mean, the mangoes are on the tree in the backyard. I can eat 10 a day easily, and every single day. But the quality of the food is delicious, and it just tastes very different. And I feel very different coming back. And I remember the last time I went to Antigua last year, and I said to myself, I was like, I'm going to eat this way when I come back to the States. I'm going to make sure, my meals are cooked every day. For every meal, I'm going to prep them beforehand, just so that I'm eating just good food every day, because I felt really good. I get back, and it lasted for probably about 2 days, and that was it. Because and it really helped me see the system that we have and the challenge that even for somebody who does have access to healthier fruits and vegetables, whether because of my income or because of where I live, it was still difficult. It was difficult because of my schedule, and our systems aren't set up to have you know, well-cooked meals. You know, I could walk down the street in Antigua and there's a little hut, you know, set up that I'm getting fresh meals. Like, they're cooking meals. It's not, you know, fast foods, but it's fresh, whole foods cooked on a plate. It's delicious. I can't walk into a store and get that same kind of food so readily and so cheaply at that. And so you know, I would say within a week I was back to my habits of sometimes breakfast, sometimes not. My rush of my lunch, you know, sometimes I have a good lunch and sometimes I really don't. So the relationship with food is complex. It's not easy. And I try, especially as a doctor, and you know, and I don't want to say, I have to say, you know, to people, you know, eat well and eat your 5 fruits and vegetables a day, and, you know, try to limit the sodium, and all this is very true. But I realize, you know, as a human being and as a person as well, being in this community, in this society, it's not easy and it's very challenging. I would love to see more demand from my community residents saying that healthy food is their right. We should have access to this like any other community in New York City has access to healthy food. I want my residents to feel empowered to do so. I want them to have the voice to do so. I want them to have the power, the connections, everything, so that they can create an environment, and so that it's not coming from, you know, I can be a partner as government. We can have community-based organizations that can help out, but it really needs to come from the residents and the people. I believe, you know, we look at all movements, whether it's the civil rights movement, the women's movement, the labor movement. Movements are movements because it's those that are experiencing the injustice. They're the ones whose voice got strongest. They're the ones whose voice became collective. They're the ones who said, it is my right to have this. And they're the ones who created the movement and really created the change. And that's what my hope is for the Brooklyn community. If you want to follow me, you can follow me on Twitter at Dr. Aletha Maybank.